Hello everyone. In first aid, now we are going to learn about emergency procedures. First aid emergency procedures provide a framework on how to approach a potentially dangerous or risky situation and or when someone is hurt. This will help you stay calm, make safe choices and reduce the time it takes for help to arrive. Some emergency procedures are routine which you might have seen in your daily life, like cuts and grazes and blisters and minor burns, but you have to be prepared for it and you are not expected to be an expert. One must remember that you are not an expert, you are just helping the expert till the help arrives. It will help you identify a possible illness or injury and act in a way that helps a casualty. During an emergency situation, it is all too easy to become confused and disoriented. But if you have little bit knowledge, training and experience in handling these emergencies, then you can stay calm and handle it better. So, you can use this single emergency helpline 112 for various emergency services such as police, fire and ambulance etc. It provides 24/7 emergency response across the country. An immediate assistance will be provided to the affected. Who to call? The national helpline for emergency is 112. Remember, your supervisor will be able to deal with most emergency and call your supervisor first. But if there is a life threatening situation or a crime in progress, you must not hesitate to call 999, then contact your supervisor. So, if you feel it is some criminal situation or some legal situation, then you call 999 before calling your supervisor. First and foremost thing in any emergency, not to waste time. So, this is a national emergency number all throughout India. So, in this number works even if you do not have balance in your phone. So, from any phone you can call 112 for the emergency situation. For most important numbers you must remember if you are a first aid trainer or a first aid executor volunteer, then national emergency number 112, police number 100, fire 101 and ambulance 102. Another emergency helplines cards are as shown in the slide: women helpline 181, medical helpline across India is 108, everybody knows, ambulance helpline 102, AIDS helpline 1097 and railway helpline 1512. In this slide it is shown other emergency numbers which may be helpful to you in in situation of disaster management services, domestic abuse, air ambulance when you want to lift a patient from one place to other place, anti-poison New Delhi number etc. Again list of other numbers which may be useful to you. For children in difficult situation 1098, there is a separate number. Central Vigilance Commission 1964, LPG leak helpline 1906, these are the commonly required number. So, 108 is the largest network of emergency ambulance services across India. The aim is of any emergency first aid in any emergency situation is 3 P's: preserve, prevent and promote. Preserve life as far as possible, prevent worsening of the situation, like you remove the victim from the dangerous situation to a safe place, and third is promote healing. By acting fast, you are cutting down the period of worsening the situation, cutting down the period of more injuries and also helping the victim till the emergency team or expert team arrives. First and foremost, as we discussed in earlier lecture also, personal safety. So, you should be, if you are a volunteer of first aid, you should have a proper equipment to protect yourself, like mask, gloves, gown, etc., goggles, and sometimes that resuscitation mask, etc. So, equip yourself, protect yourself whenever is required, and always observe universal precautions whenever you are exposed to the blood, body fluid, vomiters of the victim, then you have to protect yourself against this infection. So, the standard equipment which are required for protect personal safety or for universal precautions are mask, gloves, face shield. Sometimes face shield in a COVID situation you might have seen face shield worn by doctors and all, and gown and glasses. These are the protecting equipment you should have to protect yourself. What to do in an emergency or an accident? The most important piece of advice is to stay calm. So, if you have enough knowledge and experience, you will definitely stay calm, and only that will decrease the confusion and you know what you are supposed to do. First of all, assess using 3 A's. Is it safe? Is the victim safe or you are safe? What can you see? What you are seeing is there is a mob, very angry mob, or there is a fire, or there is an accident, or somebody is bleeding, or somebody is unconscious. What you are seeing? What is the situation? What has make this situation happen? So, see these first 3 first. First of all, make the area safe by dispersing the crowd, by removing the injury making elements. It is important to eliminate anything that presents a danger to those involved, and anyone who goes to help, including you, it should be safe. Once an area is safe, use the primary survey to assess casualty. Once you have dispersed the mob and everything is safe, area is clean, first you evaluate the casualty. Assist the emergency service, then you start giving first aid to assist the, if emergency service sometimes is already present, but if you have knowledge of first aid, you can help them. So, assist the emergency services as much and give them as much as information if they arrive after your arrival, and follow their instruction. So, primary survey is DRABC, Dr. ABC. It is really useful acronym when faced with an accident or emergency. So, D is danger, always make sure the area is clear of danger. Response, check if the casualty is responsive or unresponsive, whether patient is opening the eyes, following verbal commands, he is able to talk, or he is unconscious or semi-conscious. Then third comes the airway, breathing and circulation. You clear his airway, means upper respiratory tract, so that he can breathe, give him breathing and start compression by giving circulation. These 3 things comes under CPR, and we will know this order has been changed recently since last 5-7 years. So, this order has been changed and we will talk about it in the lecture of CPR. Suppose the victim has got severe bleeding from a wound. Severe bleeding can be dramatic and distressing. It is very difficult to see somebody bleeding. It is therefore important to stay calm, helping you think clearly and keep the casualty calm. See, if you become restless, even the victim, if he is conscious, he becomes very restless and he becomes anxious, aggressive sometimes. So, but this severe bleeding can be life threatening and victim can die within no time. So, naturally if there is a bleeding is severe, victim is likely to be in shock or sometimes emotional shock, and because of shock patient blood pressure will be very low, there will be heart will be beating very fast, and there will be cold clammy extremity, and there will be less oxygen going to other vital parts of the body. In this case, first and foremost you raise the foot end of the victim. This will bring down all the blood flow from the foot end towards the heart. You can give recovery position. We will have a separate lecture on recovery position. In this case, victim is made to lie either on left side or right side, whichever is convenient, and this will position will not improve casualty's condition, but it keeps this will help you keeping the airway of the patient clear, and he will be able to breathe better. And even if patient victim has vomited, the vomiting and other foreign secretion will come out from the mouth in this position. Recovery position is for unconscious casualty, that is unconscious victim, and they should be put into the left right or left lateral or right lateral position, and it should be monitored till the help arrives. Then one has to start CPR. CPR is usually done by chest compression, clearing airway, and by providing breath. So, for every 30 chest compressions, you have to provide 2 rescue breaths. This will talk in detail in our lecture on CPR. Sometimes victim is very cold, we call it hypothermia. The temperature is very low, like in winter season or in mountaineering and also situation, and victim happens to have some injury or accident, he is likely to be hypothermic. Or his stroke, as I said in India during summer time, if victim is outside in the sun for a longer time, he will get dehydrated and he will face a heat stroke. Being too cold or too hot can be life threatening. So, in hypothermic condition, what you will do? Usually this happens in older people also. They do not have enough system working to control their low temperature on their own. So, and heat stroke is the opposite condition, when the casualty's brain stops regulating the body temperature and unable to cool itself. It also happens after heat exhaustion. You have to deal with heat exhaustion, hopefully preventing the worst condition of heat stroke developing. So, the general advice in hot weather is to cover up with light clothing, wear a hat, keep to the shade wherever possible, do not remain exposed in the sunlight or in the heat like situation, and apply the sunscreen and drink plenty of water. So, in hot weather, general advice in the hot weather is to cover up with light clothing, wear a hat, keep to the shade wherever possible, apply sunscreen lotion and drink plenty of water. Sunburn also needs treating. Another emergency situation is asthma attack. Usually happens in a patient who has history of asthma or any respiratory illness, and suddenly he becomes breathless, short of breath, and the air passage of a casualty becomes inflamed because of the inflammation or infection, and or triggered by allergy, sometimes allergen because of exposure to dust or too much of humidity will make a patient, asthma patient more breathless. Being unable, and this type of victim are not able to breathe, and it can be very frightening experience. So, in this type of patient, you give them inhaler, whatever they are taking or whatever treatment they are taking, medicine they are taking, make them be comfortable in head up position, with not straight supine position, but slightly head up, exposure to the fan. If he is in cold condition, shift him to the warmer place and make them calm down and talk to them, give assurance that I am there to help you. Allergic reaction. Sometimes some victims are allergic to certain things, like they may be allergic to some food or some drink. Sometimes a person drinking a cocktail and sometimes they get suddenly breathless and all, or exposed to a pollen, then they become very much breathless. Someone in your team probably has an identified allergic reaction, for example, to nuts and carries an EpiPen. Being outdoor, however, increases the chance of being exposed to allergens, particularly you are on mountaineering, or you are in paddy fields or some type of farming fields, then this type of pollens or allergens are there, and you may get a attack of anaphylactic shock. It is called anaphylactic shock, where victim becomes breathless, choking sensation, then rash all over body, and lots of coughing, etc. How to treat fracture and dislocated joint? This usually happens following injury, vehicular injury or just a fall that can cause fracture or dislocation. So, fracture is a break or crack in a bone, and it is an open fracture. If it is called open fracture when the bone is protruding out from the skin, from the wound, and it is usually associated with bleeding. Close fracture means bone is broken inside but the skin above it is intact. Dislocated joint, the joint just comes out from the socket, or two bones are where joint is there, it just comes out from its position, and but you are not expert, you are not supposed to put it back, you just support this fracture or dislocated joint till the help arrives. How to treat strains and sprains? This commonly you might have seen in your colleagues, you people are just going walking and suddenly somebody slips and sprains his ankle joint, that is the most common joint to get sprained. Strains and sprains are stretches or tears of soft tissue between bones. In this you have to remember the acronym RICE. So, RICE is rest first of all, that particular joint should not be moved, it should be given rest, apply ice pack, wrap a bandage around it, elastocrap bandage, and elevate that particular limb for as much as possible to decrease the swelling in that limb. How to treat burns and scars? A burn is caused by a dry heat, hot object, fire, electricity, and a scald by wet heat, hot liquid or steam, that causes scald. Longer the contact, the more skin damage, and remember your DRABC. Burn and scars can be awful depending on the thickness of the wound. How deep is the burn or scald? That will be the cause of pain and lots of discomfort. So, if it is a superficial burn or scald, you can treat at home, but more than degree 1, you have to call an expert and refer the victim to a hospital. How to treat cuts, grazes and splinters? Cut means anything which cause injury to the skin and skin is broken apart. Most cuts and grazes can be treated with the contents of the basic first aid kit, like cleaning the wound, applying a antibiotic solution or cream and bandaging it. But if the cut is longer and deeper, it requires stitches. So, it needs to be taken, patient needs to be taken to the hospital or a surgeon. Splinter of wood, glass and metal can be usually be removed using tweeters. So, during cut, if it is because of glass, you may see a small glass particle inside the cut wound, and again this requires thorough cleaning by an expert. Blisters are small pocket of fluid underneath the skin, looking like fluid filled bump. You must have seen this usually happens because of the burn, and they are caused by constant rubbing or exposure to heat. It is not also advisable to include special blister plaster in your first aid kit. There are special plasters are available to be applied over the blister. Sometimes insect bite, usually this happens in monsoon season. If you are in garden, then various different types of insects are around, and you may get a sting or bites because of this insect. And regularly apply bite protection cream. See, if you are very sensitive to this, then you should apply a bite protection cream and sprays, and wearing long sleeves and trousers, and avoiding areas where stinging and biting insect gather, such as water. Ticks, a spider like insect living in a woods and long grass, feeding off animal and human blood is particular problem, and ticks spread serious diseases. By tick bite you can get a serious diseases. Generally bites can be treated by removing the sting, tick or hair if still in the skin. First of all, remove that particular insect if it is still stinging on your skin, and wash the area, apply a cold sponge and avoid scratching of that area, and then apply some antibiotic or anti-allergic lotion or cream. How to treat headaches? Most headaches are easily treated, although it is useful to identify why a casualty might have a headache. See, following a injury or accident, if a casualty has a headache, it can be a serious problem of head injury or some hemorrhage inside the brain, or something, some small tiny fracture in the skull, you do not know. So, you just first of all hydrate the patient, make him comfortable. If you have a plain some painkillers available, you can give the painkiller, and till the medical help arise, you be with the victim and give him assurance. So, summing up, if emergency assistance is required, dial 999 immediately, and in our case 112, and immediately, and then contact your friends and family members on cell phone. Use emergency mobile phone and emergency phone procedures. Help may be available at the nearest house or from other countryside users. Don't afraid to ask. Sometimes in your society, you might be having 2 or 3 volunteers who have got undergone training, or you might be having some doctors and paramedics. If you have their number available, always call them whenever such emergency arises. So, if someone is seriously ill or injured, call 112. You have to be ready whenever you are calling 112. What are the things to be kept ready? First of all, the telephone number from which you are calling, the exact location of the incident, the type and gravity of the emergency. You should be able to describe that how much problem has occurred, number, gender and age of casualties, how many people are affected, their number and their age, and details of any other hazard which has happened. So, they can come prepared with the equipment. And what you have to do, you are waiting. There is a lot you can do while you are waiting. First of all, as we described, make everybody safe, segregate the casualties as per their seriousness. The more serious will require attention first, continue monitoring them, record whatever has happened. You can take assistant or somebody who can write down for you, and make it easier for your friends or emergency service to find you. Take out high visibility clothing or light rucksack covers, form a chain to the nearest road. Intermittently, you have to do self assessment. After handling each emergency situation, you have to do self assessment, that how much confident, whenever if you are a volunteer of first aid, how much confident you are, what mistakes you have done this time, and how you can improve on it. So, and about these lectures also, you have to assess yourself repeatedly, and these all lectures are there in front of you. You can go and repeat your lectures again and again till you are confident about the material and knowledge you have got through that lecture. Thank you very much. So, we have discussed about the emergency procedures, and you can read this lecture again and again to become more confident about this knowledge. Thank you very much.